Most people dealing with back pain look for the answer in stretches, exercises, or a new mattress. Very few think about what they are eating, and that is a serious mistake. What you eat directly affects the level of inflammation in your spinal joints and discs, the health of the cartilage and tissue surrounding your spine, and even how well your muscles recover from daily strain. In this video, I am going to give you the exact foods that have been shown to reduce back pain, protect your spine, and keep inflammation from building up in your body. Day after day. Why food affects back pain. Before we get into the specific foods, you need to understand the mechanism. Chronic inflammation is one of the primary drivers of persistent back pain. When your spinal joints, discs, and surrounding soft tissue are inflamed, they are more sensitive, more painful, and slower to heal. The foods you eat can either increase systemic inflammation, making your back pain worse and harder to resolve, or reduce it, directly lowering pain levels and accelerating tissue recovery. Your diet is not a substitute for movement and proper physical care, but without the right nutritional foundation, your spine is fighting pain from the inside, while you try to fix it from the outside. The best foods you must eat to avoid back pain. Number 1. Fatty fish. Salmon, mackerel, sardines, and trout are among the most powerful anti-inflammatory foods available. They are rich in omega-3 fatty acids, specifically EPA and DHA, which directly suppress the inflammatory pathways that drive joint and disc pain. Multiple studies have shown that regular consumption of omega-3 rich fish significantly reduces levels of inflammatory markers in the body, leading to measurable reductions in joint pain and stiffness. Aim to eat fatty fish at least 2 to 3 times per week. If fish is not accessible, a high-quality fish oil supplement of 1,000 to 2,000 milligrams daily provides similar benefits. Number 2. Leafy green vegetables. Spinach, kale, Swiss chard, and rocket are packed with vitamins K, C, and E, as well as magnesium and calcium, all of which are directly involved in bone density, nerve function, and the reduction of inflammatory activity in the body. Vitamin K in particular plays a critical role in bone metabolism and has been linked to a reduced risk of vertebral fractures and disc degeneration. Calcium and magnesium work together to maintain the structural integrity of the vertebrae and to relax the muscles surrounding the spine. Eat at least 1 serving of dark, leafy greens every single day. Adding a handful to a smoothie, salad, or stir-fry makes this one of the easiest nutritional changes to sustain. Number 3. Turmeric. Turmeric contains a compound called curcumin, which is one of the most well-studied natural anti-inflammatory agents that exists. Curcumin works by blocking the NF-κB molecule A, key driver of the inflammatory process in the body, which directly reduces inflammation in the spinal joints, discs, and surrounding muscles. Studies comparing curcumin to standard anti-inflammatory medications have shown comparable effectiveness for joint pain relief, without the side effects on the gut and kidneys that come with long-term drug use. Add half a teaspoon of turmeric to food daily, or take a curcumin supplement. Combining it with black pepper increases absorption by up to 2,000%, so always pair the two. Number 4. Ginger. Ginger contains gingerols and Shogal's compounds that inhibit the same inflammatory pathways targeted by common anti-inflammatory medications. Regular ginger consumption has been shown in clinical studies to reduce muscle soreness, joint inflammation, and chronic pain, including in the lower back. It also supports gut health and digestion, which reduces the digestive pressure that can refer pain to the back. Add fresh ginger to warm water or tea each morning, grate it into cooking, or take it as a supplement. Even 1 to 2 grams of ginger daily over several weeks produces measurable reductions in inflammation throughout the body. Number 5. Berries. Blueberries, strawberries, raspberries, and cherries are loaded with antioxidants called anthocyanins, which neutralize free radicals, the unstable molecules that drive oxidative stress and inflammation in the joints and discs of the spine. Tart cherry juice in particular has significant research behind it for reducing muscle soreness and joint inflammation, and has been used by elite athletes specifically for recovery from musculoskeletal pain. Eat a serving of mixed berries, daily fresh or frozen, both work equally well. They are one of the most accessible and enjoyable ways to add a direct anti-inflammatory intervention to your daily diet. Number 6. Nuts and seeds. Walnuts, almonds, flax seeds, and chia seeds are excellent sources of omega-3 fatty acids, magnesium, and vitamin E. Walnuts in particular have one of the highest plant-based omega-3 contents of any food, making them a strong anti-inflammatory option for people who do not eat fish. Magnesium from almonds and pumpkin seeds directly relaxes the smooth muscles of the back, reduces muscle spasm frequency, and has been shown to significantly reduce chronic lower back pain in people who are deficient, which a large proportion of the population is. A small handful of mixed nuts or a tablespoon of flax seeds or chia seeds added to yogurt or a smoothie daily is all it takes. Number 7. Olive oil. Extra virgin olive oil contains a compound called oleocanthal, which has been shown to work in a similar way to ibuprofen in the body, inhibiting the same enzymes that drive inflammation and pain. Unlike ibuprofen, regular olive oil consumption does not damage the gut lining or the kidneys. Switching from processed seed oils such as sunflower, canola, and vegetable oil to extra virgin olive oil for cooking and dressing is one of the most impactful single dietary changes you can make for chronic inflammation and back pain. Use it as your primary cooking fat and drizzle it over salads and cooked vegetables every day. Number 8. Water. Water is not technically a food, but it deserves to be on this list because no other dietary factor has a more direct structural impact on the spine. Your intervertebral discs, the shock-absorbing cushions between each vertebra, are made up of roughly 80% water. They rely on consistent daily hydration to maintain their height, flexibility, and ability to absorb the load of your body weight. When you are chronically dehydrated, the discs compress, lose height, and become less effective at protecting the spine from impact and strain. This accelerates disc degeneration and worsens back pain directly. Drink a minimum of 2.5 to 3 liters of water every day. This is not optional for a healthy spine, it is structural. Maintenance. Number 9. Eggs. Eggs are one of the best sources of vitamin D and protein available in a single food. Vitamin D is essential for calcium absorption and bone density. Without adequate vitamin D, the vertebrae gradually lose density and become more vulnerable to fracture and degeneration. Vitamin D deficiency is also directly linked to increased musculoskeletal pain, including chronic back pain, and is widespread in populations that spend most of their time indoors. The protein in eggs supports muscle repair and maintenance, and strong back muscles are one of the most effective long-term protections against recurring back pain. 2 eggs daily is a straightforward and highly effective contribution to spinal health. Number 10. Bone broth. Bone broth is rich in collagen, glucosamine, chondroitin, and gelatin compounds that are the building blocks of cartilage, ligaments, and the outer layer of spinal discs. Regular consumption of bone broth has been shown to support the regeneration and maintenance of connective tissue throughout the body, including the structures that support and cushion the spine. It also contains glycine, an amino acid with anti-inflammatory properties that supports tissue repair at the cellular level. Drink 1 cup of bone broth daily or add it as a base for soups and stews. This is one of the most underused nutritional tools for long-term spinal health. Foods to avoid. Just as important as eating the right foods is eliminating the ones that actively worsen back pain. Processed sugar, refined carbohydrates, fried foods, alcohol, and seed oils all increase systemic inflammation in the body, raising pain levels in the spinal joints and slowing the healing of disc and muscle tissue. Reducing these foods consistently is as important as adding the ones above. You cannot out-supplement a diet that is constantly driving inflammation. That is everything: the exact foods your spine needs to reduce inflammation, protect the discs and joints, and keep back pain from coming back. Start with 2 or 3 of these foods this week and build from there. Small, consistent changes in what you eat every day compound into significant reductions in back pain over months. If this video helped you, hit the like button and subscribe for more practical back pain relief content every week. Leave a comment below telling me which of these foods you are already eating and which one surprised you the most. I read every comment. I will see you in the next one.